What's your name?
My name is Farah, aka Dr. Laurent, aka Badass Nurse Career Coach.
What are your credentials?
My credentials are DNP, MSN, ED, which is in education, and I'm 6 times board certified, 3 in emergency medicine. I'm a certified emergency nurse, certified pediatric emergency nurse, trauma certified nurse, and the other one is in education, NPD-BC, and in leadership, NEA-BC, and in inpatient experience, CPXP.
What is your specialty?
I have a lot of specialties. First specialty and my first love is emergency medicine. I was an ED nurse, level 1 trauma. And second is in education. So I was an educator for quite some time, both in academia and in the clinical setting. And then leadership. I was the director of education. So that's my specialty. And also positivity. I specialize in being a positive person.
How long have you been in healthcare?
I've been in healthcare for over 20 years. Can you believe it? I started my career when I was about 5 years old. That's why I look so young.
What jobs did you have before nursing?
Oh, great question. So I did penny savers in Canada. I worked in a market where I did like fruits and vegetables. And I also was a telemarketer for windows and doors at a young age in high school. And then I worked at a doctor's office, I think a cardiologist and neurologist filing, hated it. And then went into emergency medicine.
Which jobs or skills help you the most in your nursing career?
Oh my goodness. Well, the emergency medicine definitely like added so many skills to my toolbox, being resilient, communication skills, comedian, right? Like sense of humor. You have to have a sense of humor, connecting with people, collaboration, working under pressure. So the ER hands down has built me up and built my skills. And then number 2, I would say being an educator, because you have to have really good assessment skills, being able to be adaptable, just like in the ER. As you're teaching, you're constantly seeing like, should I be adapting how I'm teaching? And then it really helped with my communication skills and my confidence speaking in front of so many different people. And then now being a speaker, I think it definitely has helped me.
What or who motivated you to go into nursing?
So I would say I was always kind of self-motivated. At a young age, I knew I wanted to be in healthcare, particularly nursing. Some of my family members were like, "Are you sure you don't want to be a doctor? Be a doctor. It's better." And I'm like, "Listen, let me do my own thing. You do you, I'll do me." And I loved nursing, particularly Trauma Life in the ER. Love that show. And I was like, that's the type of nurse I want to be. I want to be a badass level 1 trauma nurse. And that's what I did.
Did you consider any other role in healthcare?
No, I kind of knew I wanted to be a nurse. At one point, I thought like, oh, I'm going to be a sports medic because I like sports. And I liked, being active and being out there. And then I thought at one point that maybe I want to be like a chief nursing officer. I don't know. I still kind of struggle with that sometimes, because I don't know if I want to be up at that level, because there's a lot of like bureaucracy and red tape, and it's tough to make changes. But yeah, and then now I'm like all about entrepreneurship as well. So starting my own business. So I would say, yeah, that nursing has really been my love.
How do you respond to the question, why didn't you become a doctor?
Because I just felt like nurses connected more with patients, and I felt like they spent more time with patients, and I love to talk to my patients, especially being in the ED. It was just so interesting meeting different people, and I feel like physicians do speak to patients, but it's more, it's like very quick. I just feel like they don't have enough time to really connect with their patients as much, so that's why I chose nursing.
What do you wish you knew or did before nursing school?
Well, if I had a lot of money, like, I would say travel more, but I did travel quite a bit as an emergency nurse because, I was single, pre-kids. I lived at home to try to pay off all my loans, and then I was able to travel, still living at home. So I've been to different places like Cuba. I took a trip to Europe for like 3 weeks. I love to travel, so I would say probably travel more. But I kind of did that, and trying to think. Yeah, that's what really comes to mind.
Where did you go to school?
Oh, the globe. Where's the globe? Okay, so I went to school at the University of Windsor. This is in Canada. I did my bachelor's there. Then I did my MSN specializing in education at Norwich University, which is in Vermont. Most of it was online. Didn't get to graduate because I was pregnant, and I was like due the same week I had to graduate, so we couldn't drive up there. So that sucked, but I got to graduate from there. They're a big military university as well. So it was really good to go there. And then my doctorate I got at Monmouth University, which is in New Jersey, and I got a DNP in organizational leadership.
How did you pick your schools?
So the University of Windsor, I wanted to stay home, even though it was really attractive to go somewhere like Toronto, because, it's a hype city, lots to do. But I was like, you know what? I'm going to stay home so I can save some money. And I was just practical that way. So that's why I chose the University of Windsor. And then I chose Norwich because somebody that I was working with in the ER had that program. It was online and it seemed very reasonably priced. So I said, well, I'm going to choose that program. And they shipped my books. They're very organized. And I thought that was great. And I was like, oh, Vermont sounds good. And it's cool to be like, oh, I didn't want to keep going to the same school for all my degrees. And then Monmouth University, I wanted a DMP program that had a physical university. I didn't want one of these online programs that didn't have a physical university. That was just me. I did a lot of research on that university and I saw some past graduates, alumni that I really respected, and I thought that would be a really good program, and it was accredited and all that, so that's why I chose that one.
Did you shadow anyone before pursuing nursing or your specialty?
No, but I did do some volunteer work in the hospital. I also volunteered for the Canadian Blood Services, which is like the Red Cross in Canada. And then I had some jobs, like I said, related to healthcare and doctors' offices and stuff, but didn't shadow per se right before nursing. But yeah.
What motivated you to advance your education?
Because I love to learn, as you can tell. I got 6 board certifications. I'm always learning. I love to learn. And I just felt like it would open up more doors for me. And I also love being a mentor and precepting other nurses, and being an educator. You have to keep up all your skills and constantly be learning so you can be a good educator and help other people as well. So that's why I'm constantly learning. And even now, even as a doctorally prepared nurse, I still love to learn from others. I still take continuing education courses. As a career coach, I have coaches where I learn from. And also I'm learning a lot about business, a lot about marketing. So I'm reading tons of books, going to conferences and things like that. So I just love to learn.
Did you receive any financial support or tuition reimbursement?
So yeah, I did in my BSN program. Obviously my parents, like I said, love them. They did a lot for us, but as a first generation immigrant, didn't have the luxury of like my parents being able to pay for my school. So like I said, I was very practical, always had a job to support myself because I didn't want to be a burden to my parents. So I took out loans for that. MSN program, partly the ER paid a little bit for it, but I had to pay out of pocket. DMP, same thing. I paid mostly out of pocket, but I had to take, I think 1 semester I had to take a loan. And then I got some doctoral scholarships from the ENA, the Emergency Nurses Association, from the Society of Trauma Nurses as well, and some other scholarships I got as well throughout. Oh my God, they're working on my roof. That scared me. Okay, sorry.
Your strategy for paying back student loans?
So really, I tried not to have too many, but I just, basically pay as much as possible whenever I can.
Advice for nursing students in clinical rotation and orientation?
So I would say ask a lot of questions. Don't think it's a stupid question. Other people probably still have the same question you do. Seek out opportunities. Don't be afraid to ask and say, hey, can I go see this procedure? Can I do this? Be proactive. Talk to your patients, especially if you don't know what their diagnosis is. Patients are willing to explain what it is, and they're more like happy to explain what their experience is, because two people may not have the same thing. Like if two people have diabetes, they may have totally different experiences and how they like to do things. So learn from your patients, have mentors, have multiple mentors, and just ask your clinical instructor. Do not do anything without your clinical instructor, and continuously learn. Like when you're done your clinical rotations, make sure you go home, read up on things, and be ahead of the game. So just continuous learning.
What's one thing you think students should know about nursing that's not taught in nursing school?
So I'm just real, right? Nursing can sometimes be a little rough, right? So it's not all rainbows and unicorns and peaches, right? This is like real life stuff. This is life or death. You need to be prepared and you need to be accountable. Don't go in there and be like, oh, I didn't know that. Oh, I'm not sure how to do this. You are accountable for your practice. You are a professional. So you need to go out there and treat it as such. Be professional. Take it seriously. Read on different topics. Look up policies and procedures. No one is your friend. I'm sorry to say, you don't go there to make friends. Yes, it's nice if you're like connecting and whatever. Don't trust anybody. This is real talk. If somebody tells you to do something, make sure it's like the policy of the hospital, it's the procedure, because what you're doing, what like hospital A is doing down the street is not the same thing that your hospital does potentially. So you need to know your policies, procedures, practice within your scope of practice, because what they're doing in the ICU, you can't be doing in med surg. You need to know what IV push meds you can give or not give. You are responsible for your practice. Take accountability for it. And then just learn how to connect with other people, learn how to communicate effectively. Don't be afraid to pick up the phone and say, hey, listen, I'm concerned about this patient. Advocate, advocate, advocate for yourself, for your patients, for the families, and for your colleagues. They will try to bully you and like push you around. That's just the nature of the industry and other places as well. But you need to be able to advocate and stand up for yourself.
What, if any, changes would you make about nursing education and training?
I would say that it needs to be more standardized to the specific area that you're going to. And it needs to be longer, especially for new nurses. Residency programs are great because they're designed to support nurses for about a year, and they're very structured and organized, but not all orientations are like that, especially for nurses transitioning to other units. Please ask for more orientation if you need it, I would say, and especially leadership. Sometimes there's no leadership orientation, so please seek out opportunities to learn more for leadership.
When and how did you get your first mentor?
I would say I've had a lot of mentors over the years. I don't know specifically what maybe was the first one. I would say maybe my preceptor in the emergency department was my first true real mentor, because even when I finished precepting, I still went to that preceptor to ask for things. So I would say probably my preceptor stayed my mentor to the course of the 5 years where I was in that emergency department. And then I've had several informal and formal mentors that I looked up to.
Advice for how mentees can add value to the mentor-mentee relationship?
So I think as a mentee, you're always constantly asking questions to your mentor. So the mentor has to be on top of their game and know their stuff and tell you the right things. So it elevates their practice because they have to be their best to be able to also guide you correctly.
What specialty did you think you were going to get into at the beginning of your journey?
I think I always knew that I wanted to be an ER nurse. In the beginning, I wasn't quite sure. I knew what I hated. I hated obstetrics. didn't like maternity whatsoever. I'm like, I don't want to hear about nobody's lochia. I don't like it. Get me away from it. And I hated med surge. Didn't like it whatsoever. I'm like, I do not want to be a floor nurse. And then when I got to the ER, I'm like, this is my home. This is my love. This is what I like.
What attracted you the most to your current specialty?
So right now I would say I'm in education and leadership, and then really entrepreneurship. I know nursing school doesn't have nurse entrepreneurship and courses like that, but I really would like to see that in nursing school. I love business and I love leadership. And I think education, you're always an educator no matter what. So that's kind of what I love, combining all those skills and everything together. So I would say entrepreneurship, the reason why is because you could be very creative, innovative, you could do your own thing. I don't like really restrictions and things like that. I like to be creative. And I think as an entrepreneur, the idea of generating your own income is very interesting, because as a nurse, we're always taught like to work for other people. But as an entrepreneur, you make things happen. You're able to make money moves. I wrote a book, Nurses Making Money Moves, A Nurse's Guide to Starting a Business. I think we need to talk more about that, because we're taught in nursing school like, oh, you're a nurse, you're taking care of people. Don't talk about the money. But hey, you got to talk about the money because it's important. It's a tool to be able to help your loved ones, help you do things. So I think entrepreneurship and nursing is where it's at.
What deterred you from the other specialties?
Like I said, I think I loved having autonomy. I loved as an ER nurse being able to triage patients and figure out, like as a detective, what's going on and make decisions on my own without the physicians, because we ran the ER typically as an ER nurse. You're the one seeing the patients up front, deciding what it is, and then really collaborating with the physicians. And it's not like them telling you what to do all the time. It's a very cohesive, like collaborative relationship. So that's why I liked med-surg. I didn't like it. You had to call the physician for things. Half the time they're not there in the ER. They're right there. You're like, hey, come see this patient. And I love being in the different areas. I love triage. I love fast track. I love taking care of trauma patients, critical care patients. There's so many things going on, and I love to do it all, and I don't like to sit still. So I just love that independence and that autonomy and that adrenaline rush, right? I just like excitement, not knowing what's coming in and being like on your toes.
How would someone know if they have what it takes to be in your specialty?
So I think you just have to really follow your passion, see what it is that your skills are and what you love. You don't have to work in a hospital. You can work in community, you can work in home care. I think if you want to be an ER nurse, you need to kind of be laid back, have a very adaptable type personality, because it's go, go, go. You have to be able to critically think, be able to collaborate and work well under pressure, stay calm, be able to really reduce people's anxiety and really focus and prioritize. So I think not everybody is cut out for the ER, but if you are, because that's what you're attracted to.
Who should not enter your specialty?
I think just people that are maybe looking for a little bit more calmness, things are more structured. Maybe like the OR can get kind of crazy, but it's more procedural. So maybe if they like one patient, like to focus on one thing, probably shouldn't get into the ER because it's so chaotic and there's so many things going on.
What does continuing education look like for you?
So I think you always have to be learning and learning from different people, different sources, and then staying up to date.
It's not working so much.
Okay, don't worry, just get another one. Sorry, this is the kids in the back. Okay.
What does professional development look like for you?
So professional development, I think, doesn't have to be just nursing, but you can always seek out opportunities. Networking is huge. Mentorship is huge, as I talked about. Going to conferences has been a pivotal thing for me, like learning from other people and speakers. And sometimes I said like non-nurses. So being a part of organizations is very important, like the American Nurses Association or whatever one you're interested in is important for professional development.
I spell blue.
BLUE. Sorry.
Wait, oh, you're fine. What does networking look like for you?
So networking, I think I regret not doing more networking early on in my career. But like I talked about, going to conferences, meeting people on Zoom, going on LinkedIn. I love that platform, meeting people on LinkedIn in person and virtually. I think there's so many opportunities out there for networking. And I think it elevates also your career, because once you're connected to a lot of people, that's just the way of the world. Sometimes you're able to get positions that way. So yeah, I would say networking is instrumental to your career. Sorry, give me a minute.
Where did you learn how to negotiate?
I think first from reading and talking to other people. I did not learn in nursing school that you could even negotiate your salary. And I'm sad about that, because if I knew, I would have done it much earlier in my career. So I say just reading and watching videos and talking to other people and following negotiation experts.
How, if at all, has your nursing practice affected your relationships?
So I think my nursing practice, along the way, I've met some really good nursing friends. Nursing, I think it's just so hard to separate nursing from your personal life when you become a nurse. But I'm always like very involved in the community. And I just love to give back. That's why I have a show called The Nursing Dose with Farah, where I'm highlighting other nurses, amplifying the nursing voice, also amplifying the, I guess you could say, the nursing profession, because a lot of times there's a lot of negativity with nursing and healthcare, but there are so many great things. And I like to also shine light on the positive things of nursing, because it's been really rewarding.
How many hours do you work per week?
So currently I'm not working because I got laid off, but typically it would be like 35 hours or so. And in my business, it just fluctuates as to how many clients that I get for coaching, for resumes, cover letters, interviewing. So it could be anywhere from like 10 to 20 hours right now. And also content creation. I'm creating a lot of content on LinkedIn. I'm doing my podcast, which is called The Nursing Dose with Farah, and also recording live shows on LinkedIn. So it just depends, but I would say like 10 to 20 hours or so a week right now.
Do you work nights, weekends, or holidays?
I work all the time on my business, but before that, I was strictly working day shift. I really believe that for my 9 to 5 type thing, I want to have a day job so I can be off weekends and stuff with my kids and my family. But for entrepreneurship, I think in order to advance in your business, I just kind of work anytime because I'm always creating.
On average, how many patients do you see in a day?
I don't see patients anymore, but I used to in the ER sometimes see in a day, a lot. I could have at any point sometimes 15 patients at once. So sometimes I could easily see 100 patients in a day in the ER.
What's your typical day look like?
Typical day with the kids now, wake up with them, make breakfast. I'm on LinkedIn creating content throughout the day, taking them to the park, doing different things with the kiddos, cooking once in a while. My husband would like me to cook more, but you know how it is. And then cleaning and stuff like that, the house duties. But I love to travel. We just came back from Canada. Recently, I visited my family there. So love to travel. But I'm always like, getting into different things. I love talking to nurses and doing my coaching.
How much time do you spend on charting?
0, thank God, right now, because I'm not in a direct patient role.
What's the most common advice you give to your patients or students?
Sorry about that. I would say the biggest thing is know why you're doing something, the rationale. Don't do things because you're told or because there's an order. Know the why and the reasons behind why you're doing things. And then the other thing I would say is I'm always telling them to advocate and really develop themselves and develop their skills. Just because they're telling you that you don't need ACLS for the job doesn't mean that like you shouldn't get ACLS. Constantly improve, learn, get better, and then get mentors. But advocate, and communicate.
What's your most memorable patient encounter?
It's hard to say what's a memorable one, but I've had various ones where patients have told me that I was very impactful to them, and then like they've asked me like, oh, can you come up to the floor and take care of me because you were so great. So things like that, like minor interactions, but can't think of something that really stands out. But I would say like they've written letters, like thank you letters and things like that.
And your most challenging patient encounter?
I've had many because I worked in the ER. So a lot of patients were upset, or maybe some behavioral type patients. But I always, I think, just handle them because you just have to be adaptable. So I think you just have to come from a place of understanding and the perspective of like, they're afraid, maybe they're scared, they're vulnerable, and you're there to help them and not to take everything personal. And that's what you have to kind of come with.
What's the toughest part of your job?
So right now I would say as a nurse, before it was like not being able to take things home, because it's very tough to separate the two. And then now I would say is client acquisition. So getting more clients, but I think it's through marketing on social media and referrals and things like that to get more nurse clients to come to me for coaching, because I really help transform their lives. They're able to get jobs, get out of toxic workplaces, and then they're more confident. But I think client acquisition would be one.
As the most challenging?
Yeah.
So then what's the most rewarding?
Oh my goodness. The most rewarding right now in my business is when nurses get a job. I just helped a nurse go from 0 to like 145,000 a year. She was making nothing as a new grad. Took her like 6 months to find a job. And then I helped her only like, we had 2 or 3 sessions together. She was able to land her job, her dream job that she wanted in California. And now she's making $145K a year. So I love that because I feel like it's me all over again, getting my ER job and what I really wanted, because I don't want nurses to settle for any job. I want them to be happy. I want them to be prosperous, and really living their best life is what I say, because it's not all about work. Nurses need to realize, like, plan out what lifestyle you want and then fit it to the type of work you want, and make sure you go into something that's fulfilling, so that you have your joy in nursing, because nursing is a wonderful profession. You just got to find what it is that you want to do.
What's your best clinical skill?
I would say putting in IVs. I was pretty good at that. And I would say communication, just connecting with my patients, talking to them, making them laugh. I would say those things.
Who are you most grateful for on your care team?
I would say other nurses. I was grateful for other nurses because we were always a team, working as a team, especially in the ER.
Do your friends or family ask you random medical advice?
Yes, they do. And I tell them to go see their physicians or primary care. And then when I try to educate them when I can.
Do you give unsolicited medical advice to your friends or family?
No.
Do you ever get nervous or anxious? If so, how do you manage those feelings?
Oh yeah, I'm definitely human. I get nervous and anxious, especially when I'm about to do a speaking gig in front of a lot of people. But I think I manage that by thinking that I have something to share. I have a message to share. So I take myself out of the equation. I turn things more into excitement. So if I'm anxious or nervous, I try to take action on it, because it's probably that maybe I'm overthinking something or not taking action. So I try to take action, and then deep breathing helps, taking walks, journaling. I just put out a journal on Amazon, if you look out Dr. Farah Laurent, you'll see 90-day gratitude journal. So I just put that out. Check it out on Amazon. But yeah, writing helps, talking to other nurses or other people. But I think breathing is a big one, and taking walks.
Perfect. So what are your hobbies outside of work?
Photography. I haven't done it for quite a bit, but I love photography. I love traveling, love eating, love learning about different cultures, love stand-up comedy, love concerts. What else? So many different things. I collect postcards, and of course, love hanging out with the kiddos and the family.
And so how do you spend your days off?
So my days off, if it's like the summer, because we're in New Jersey and it's cold, I love going to the beach. That's like my away place. And then love going out for walks. Probably should work out more. I don't work out enough. But those are, I would say, the two biggest things. And then love to watch movies as well, like comedies and things like that.
Who do you go to for help?
I would say my family, talking to my family, my husband, or help in the professional sense. I talk to other business owners, other nurses to get ideas.
One thing you're afraid of?
Oh my goodness, I hate driving on the highway. That's my thing. I force myself if I have to, but I'm not a big like highway driver person.
Coffee, tea, or soda?
Oh, I would say number one is coffee, but I do like a good tea.
Scrubs or no scrubs?
Scrubs when I was in nursing. Yeah.
Are you an introvert or extrovert?
Oh, definitely. I would say extrovert.
Do you think there are more introverts or extroverts in your specialty?
Do I what?
Do you think there are more introverts or extroverts in your specialty?
I think in general, there's probably more introverted people in life. So I would say introverted.
We're hanging out for the day. What's on the agenda?
Ooh, goodness. We're probably going somewhere outside, definitely eating something good, maybe like Mexican or seafood, laughing quite a bit, maybe going to the beach if there's a beach nearby, and just having great conversation and just and laughter.
How many hours of sleep do you get on average?
Ooh, it depends. So I'm a good sleeper. Like if I could sleep 10, 12 hours easy. But on average, I would say I probably get like 6 hours, maybe 7.
When does your day typically start and end?
Probably starts about, depends when I have to bring the kids to school or whatever. But I would say like 5:30, 6 a.m. And then it depends. I'm sometimes a night owl, so it could end at like 12, 1, 2 a.m. If I'm super tired, might end at like 10. Just depends.
If you weren't in nursing, what would you do?
So I always wanted to be a dance choreographer or a photographer, I would say. Or a DJ. Love DJ. Love
How much
music.
longer do you think you'll practice or work?
I'm not really into giving direct patient care anymore. Kind of did that for 13 years in the ER. But I love being an educator. So I don't know. I think I'll just continuously be in the nursing field, but just doing different things, especially with my business, career coaching, speaking, writing. I love to write. I just have an article coming out soon from Sigma International. And it'll be released next week about healthy work environment. So I love to write as well. Maybe another book because I'm trying to write another book on nursing entrepreneurship. So yeah.
What should someone who's considering nursing do to prepare right now?
I would say talk to other nurses and shadow, if they can, shadow different areas and get mentors. Yeah.
How has your experience in nursing changed the way you see the world?
I think I'm a lot more grateful. I've always been a happy type, grateful person, very practical, but I think nursing really opens up your eyes to different perspectives, different cultures, what people are going through. So I think I'm just a more grateful person. And I feel a privilege to be a nurse, and it's an honor.
What's your perspective about the current state of healthcare?
Ooh, I don't know if we have time for this. I would say in a nutshell, I'm very positive about the future generation of nurses because there's a lot of innovation going on. Nurses are speaking out more advocacy. And my mission is to empower nurses globally to really change the game of nursing and healthcare. Especially health policy is big. I think nurses are getting more involved. So I'm very optimistic, but also there needs it's very complex. Nursing needs more love from just entirely. It's not all about money. So leaders need to understand in organizations to really invest in their employees, make sure they're happy, because when you have happy employees, they stay, there's more retention and they're able to give better outcomes. There needs to be more diversity in healthcare and in the nursing workforce. So that's something that I'm very interested in. And also more diversity in the faculty to really help our new generation of nurses so that we could provide better care for our diverse communities. And I think globally, we just need to do better with health promotion, prevention, screening, and more education. And I would love organizations to support educators more because even me as a director of nursing, I got laid off a while back. I feel like sometimes organizations don't value education and educators as they should, but we're really the pillars to really bringing up the new generation and making sure that things are done correctly to make sure that patients are safe. So it's very complex, but I think we're only going to solve healthcare issues from having open conversations, advocating, and collaborating more.
Is healthcare a right or a privilege?
It's a right. It's a right. It's a human right.
What changes are taking place in your specialty as it relates to clinical practice and in research?
I think AI is playing a big role in diagnosis and things like that. A lot of people are afraid of AI, but I think we need to embrace it. And there's a lot of different technologies coming up, which I think will make healthcare more efficient and help healthcare. So I think that's kind of like probably the biggest piece there.
What do you want the public to know about nurses?
Nurses do a lot, and I think the public doesn't understand what nurses do. Nurses have different roles, not just in the hospital. As an ER nurse, yes, I was saving lives, helping people, educating, but there's a lot of different things. Nurses are everywhere. Nurses could be on cruise ships, working for United Nations in health policy, working for the government. Nurses do a lot, and I feel like we're the glue to healthcare. And people don't understand the value of nurses sometimes and the vast knowledge that we have to really change healthcare globally.
If you had one more hour in the day, what would you do with it?
That's a good question. I would say just be able to enjoy more time, like quality time with the kids, because I think it's tough sometimes as a mom trying to do all the things. So really, I think spending quality time with them and like playing more, I would say. So I probably need to do better with that.
What's your opinion of healthcare professionals using social media?
Go for it. I say they should be on social media. Just be careful to, I guess, what your institution allows you to do and not do. So really just read all the fine print of like the policies and things that they have in place. But nurses should be more on social media, speaking up on different topics, educating the public. So I think there's no problem with healthcare professionals being on social media.
What did you think you were going to be when you were a kid?
Like I said, I love dancing and I love music. So I always thought I wanted to be in the space of like music, the music industry and like dance.
What advice would you give your younger self?
I would say probably listen more to people because I have a tendency to like interrupt and I get excited. And then probably have more mentors. and not be so stubborn sometimes. But I think that's part of what has led me to the success that I've had so far, is because I'm very convicted. I have a lot of conviction, and when I want something, I go for it, and nobody can tell me nothing else. So I say, yeah, probably having more mentors and just listening more.
What would you do if you could do it for free?
What I'm doing right now, coaching nurses, elevating their game, making sure that they're in careers where they should be, speaking to the public about creating healthy work environments for nurses, because there's too many crazy toxic leaders out there that are ruining it for the new generation of nurses and creating a lot of mental health issues. So I think just what I'm doing now, speaking up, going to events, networking, helping nurses. What's up, doggy?
What can we expect from you in the next 12 months?
I would say quite a bit. You're going to see me probably on more podcasts, more shows, hopefully on more shows like Jennifer Hudson, like maybe Kelly Clarkson on the Today Show, hopefully on the news. I want to try to be a contributor. I'm currently working with Alice Benjamin, American's Favorite Nurse, to see how I could potentially be a contributor. I'm going to write more, hopefully have a book out on nurse entrepreneurship, and be speaking more on different stages. What else? And really be busy in my coaching, and hopefully be doing it full time a year from now.
Last question.
And also teaching in academia full time remotely.
Okay. And last question. What advice would you give the aspiring, working, married mother who wants to be a nurse entrepreneur?
I would say stay positive. It's not easy. Keep doing it. Do what you think is right, because you're going to get a lot of different feedback from people. You're going to read a lot of books. There's no one right way to entrepreneurship. It is what you make it. But obviously learn from the best, right? So I follow a lot of millionaires. I follow a lot of marketers. So that's kind of how I'm learning, YouTube University. But take action. Do things, because that's the only way you're going to learn. Entrepreneurs talk about failing a lot. They say fail fast and learn from it and keep going. So, early on when I made videos on social media, probably horrible. I'm getting better. It's continuous improvement. Networking is huge. And I just think, like, putting yourself out there, just being visible. This podcast is amazing. Create things where people can see you, and be more diverse. So you need multiple streams of income, but try to do one thing at a time. It's hard because I try to get into different things, but just do what feels right. And you need a lot of money management. And that's what I'm trying to learn more. Money management, and really getting things systemized and operationalized. So having better systems and procedures in place, and learning how to sell, how to promote yourself, but having like a proper sales call if you're trying to sell a product or a service, or if you're trying to promote yourself, just be more diverse. Be on other people's podcasts so you can be out there visible. Write if you're interested in writing, whatever it is that can get you out there, because in business they say, if you're not visible, nobody's going to know about your business. So you need the know, like, trust factor. People need to know you, people need to like you, and people need to trust you. And then also authenticity. Always bring your authentic self. Sounds cliche, but seriously, people will connect with you when you're authentic. They'll feel like they know you. And then the last thing too is you never know who's watching. So continue to create and continue to just do what it is that you want to do, because eventually it will take off. And then consistency. Consistency is huge. All the stuff that I watch is all about being consistent. and having self-discipline to be able to succeed in entrepreneurship. And then you have to believe. Nobody else has to believe in you. You will have a lot of haters, right? And doubters and naysayers. As long as you believe, you will make it. That's it. You just have to believe and stay consistent.
Thank you for your time.
Thank you. This was fun. Thank you so much.